Hello everyone, welcome to sqadia.com. Today we are going to talk about the new frontiers in surgery. These are laparoscopy and the robotic surgery. The lecture has been divided into 5 sections. In the first section, we'll talk about the minimal access surgery. We'll first talk about the need of why this minimal access surgery was developed and the advantages of these minimal access surgeries are. Then we'll talk about the definitions, the principles and the types, and finally the advantages and limits of the minimal access surgery. In the second surgery, we'll talk about robotic surgery. We'll first define the robotic surgery, then we'll talk of the types of the robotic surgery, then the applications, the advantages and the limitations of robotic procedures. In the third section, we'll deal with the preoperative and the intraoperative principles. These will be looked upon these would be looked upon considering the minimal access surgeries, the laparoscopies, and the robotic surgeries in mind. Then, in the fourth section, we'll talk about the preoperative and operative problems that might arise in these newer frontiers. And finally, in the last section, we'll talk about the post-operative care. In the post-operative care, we'll talk about the hazards of these new frontiers. We'll talk about post-operative care in detail and the development of and the further new developments in the minimal access surgery. I hope you're excited about today's lecture. For further such lectures, keep watching sqadia.com.